In a single hospital visit, one patient may receive up to 40 standard Lure connection devices. And from admission to discharge, the patient will likely be touched by multiple clinicians with different skill sets from different departments and for different clinical reasons. Even with the best training and care, the risk of an accidental misconnection is high and real when using a universal design across applications like IV, enteral, and regional anesthesia. A misconnection error can have devastating consequences: permanent nerve injury, paraplegia, even death. And one of these errors is simply one too many. But there is good news. Most of these errors can be prevented. 10 years ago, the International Organization for Standardization, or ISO, along with a group of manufacturers, clinicians, and regulators, began work on reducing the risk of misconnections between two unrelated patient delivery systems. The result of that effort is ISO 80369, a series of design standards for small bore connectors designed to improve patient safety and reduce the risk of misconnections. BD has supported this initiative from the very beginning and is specifically involved with Part 6 and 7. This sweeping standard provides connector design requirements across many healthcare applications. For neuraxial applications such as spinal and epidural anesthesia, the ISO 80369-6 standard requires neuraxial device connectors to be incompatible with small bore connectors used in other applications. This kind of misconnection error prevention is called a forced function innovation because it removes any possibility of misconnecting unrelated systems. As a result, forced function innovations are the most effective and reliable methods of error prevention. For ISO 80369-6 neuraxial applications, products with this design are called NRFit devices. NRFit is the name selected by GEDSA, Global Enteral Device Supplier Association, and members of the ISO Joint Working Group to denote neuraxial anesthesia devices compliant to ISO 80369-6, but the NRFit name is not part of the standard itself. Many regulatory bodies are embracing the new design standard. The Joint Commission recommends transitioning exclusively to the new ISO standard as soon as possible. Healthcare facilities are required to adopt NRFit technology for epidural use in California. And in the UK, there is an expectation that all organizations providing NHS-funded care will implement the new NRFit devices. Small design changes create a connector design unique to neuraxial devices that is not capable of connecting with Lure devices. One of these design changes is the addition of a collar to slip syringes. In addition, the NRFit locking connection will require an extra half rotation on average compared to traditional Lure connections. And the industry has chosen yellow color coding for NRFit devices to make them distinguishable from Lure systems. With NRFit products, care teams can work collaboratively across shifts, across departments and skill sets with a goal of minimizing misconnections and advancing patient safety. BD is pursuing the development of a full portfolio of ISO 80369-6 compliant designs for neuraxial procedures from medication preparation to administration for spinal, epidural, and combined spinal and epidural anesthesia. As a leading manufacturer in regional anesthesia products, BD is committed to driving innovation. For over 100 years, BD has built its legacy on performance and trust through the delivery of high-quality products, service, and support. It's time to start planning your transition to improved patient safety with NRFit devices. Our world-class support and service and our commitment to helping you make the transition to improved safety with NRFit devices mean you can keep your focus where it matters most, on providing patients with the very best care possible.